Hello and welcome to the Health Channel, all health all the time. I'm Laura DeAngelis, coming to you from the Baptist Health South Florida studios in Coral Gables. In this hour I am here with Dr. Deepa Sharma, a family medicine physician with Baptist Health Primary Care. And Dr. Sharma, we are so glad to have you with us for the hour ahead. We're going to hear about a lot of great stuff. Today we're actually talking about women's health, and what women want, just like pretty much everyone else on the planet, is they want to be happy and healthy. Now, medical science is discovering as a general rule that the more optimistic you are, the healthier you can be. So Dr. Sharma, what do you think about that?
I couldn't agree more. I think that having an optimistic outlook is so important. I was excited when we talked about discussing this, and I was more excited to find out that there is medical evidence to support this information, that studies have been done looking at outlook and the outcomes associated with having a positive outlook. So I think this is great.
All right, positive all around for sure. Now, before we kind of get into those studies, let's talk a little bit about you. I mentioned you are a family medicine physician, but you're also an osteopath, or a DO, as some of us see next to doctors' names when we look up your listing. So tell us, what does that mean? And I guess, how does that differ from being an MD or a medical doctor?
That is a fantastic question, and I actually get that asked a lot. In fact, my office will commonly say that when patients call, they ask that question, so I've actually talked to the office staff about what it means as well. Without being too historical, basically a doctor in the 1800s, a medical doctor, was somewhat dissatisfied or disheartened by the practice of medicine at that time. Okay. Mostly because he found there were more harms than benefits, again, at that time. And he decided to start his own practice, and this was called osteopathic medicine. And what he decided to do was look at people as a whole, the patient not just as a disease or an organ or cells, but rather the entire picture. So he founded osteopathy, and then osteopathic medicine came into play in the 1800s, and it has since evolved. We're now about 15 to 20% of the physicians in the United States. Okay. We are licensed the same way medical doctors are. We practice in all 50 states, in all specialties. There is no limits on our license or practice. And actually, I haven't been trained as an allopathic medical doctor because I went to osteopathic medical school, but my residency was with medical doctors, MDs, okay. Traditional MDs. And I would say the curriculum over time for all physicians has evolved to really encompass the entire patient. I would also say that probably in the last 20 years, medicine has moved away from being paternalistic and has become more collaborative. So there's more shared decision making. And so I think the distinction between an osteopath and an allopath is less pronounced, but it's just a slightly different training.
Okay, and speaking of that training, is there anything extra or more hours, so to speak, that you spend in, say, a certain area of your education or in your training than an MD might?
Yeah, that is the case. So we start from day one in osteopathic medical school dealing with patients, a very hands-on approach, learning to feel tissue, the texture of tissue, to understand the mechanics of the body. Osteopathic manipulative therapy is another type of training that we receive. So it is in addition to the typical medical training.
Okay, so again, osteopathic physicians treat the whole body, and this branch of medicine is based on the idea that all the body systems are interrelated, which you just kind of touched on, and they require, the proper care. So again, though, I guess maybe a little bit further on how the training for medical doctors is incorporated into your training, how they're kind of intertwined, even though they are different.
So osteopathic, one of the fundamentals is trying to see if the body can heal itself, so the innate potential to heal itself. And so it is not meant to be a substitution, but it's kind of like my first thought when I see a patient is, what is going on and how can I physiologically help their body heal themselves, as opposed to pulling, extraneous or exogenous things like prescription drugs. Is there something we can solve with exercise and diet and lifestyle instead of a prescription?
Okay, it's interesting. I was actually treated by an osteopath back home in New York. I had a shoulder injury for a while, and he was an osteopath and really helped me. And again, it was more about muscle movements I could do, I guess physical therapy, and I'm happy to say everything did work. work out really well. So I've had a little experience with osteopaths in my own treatment, and it definitely, helped me a lot. So, but I think a lot of people, again, they have questions about it. They might not be certain. And another one of those questions are there any populations in particular that might benefit from osteopathy versus a traditional MD, or is it, again, kind of treatment for everyone? Again, I just mentioned I saw a shoulder specialist, if you will, but what about that?
I think that depends more on the patient. So I think depending on what the patient's expectations are for their treatment, that would help guide them on to whether an osteopathic physician is the right choice for them or not.
Okay, that actually makes good sense. All right, well, we've talked a little bit about that, and now let's kind of talk about you. Again, you are a family medicine physician, an expert in primary care. So why is it so important for everyone to have a family doctor?
Yeah, that's a great question. Actually, when I was in medical school, I didn't have the answer to that question, and I got asked that a lot. But I think there's a couple of really important things. One, to have a relationship with a physician, both in sickness and in health, but it is a relationship. And so finding a primary care doctor, you're lucky if you find somebody that's the first doctor you've ever met. I myself have had to meet lots of primary care doctors before I found someone who understood me, my needs, and my expectations. And then to develop that relationship so that you can understand your health, your well-being, and then if a problem arises, to have a relationship with someone that you trust, because at that point you're probably at your most vulnerable, you're feeling scared, and that's probably not the best time to try and establish a new relationship.
Right, I think it's very true. I'm sure our viewers would agree that trust is really a key. You have to be comfortable when you're dealing with your family doctor, because you might be seeing him or her for a whole variety of situations. Some not so serious, could be a common cold, and it could be something much more difficult. So trust, I think, is key. Right?
Trust is key, and then having your annual exam is important. That's the in-health part that I was referring to. There are a lot of illnesses that do not present themselves, and so you have to be screened for them. I usually tell my patients that they need to know their numbers. I don't know if you've heard about this before.
Okay, let's explain that. Maybe, I'm sure some of our viewers have not.
I'll explain what know your numbers are. So the way you know your social security number and the PIN on your cell phone, you should know these numbers. These are the ones closest to your heart. They're your blood pressure, your blood sugar, your cholesterol. These are not numbers that you necessarily have symptoms from, but they do increase your risk of stroke, heart attack, or organ damage. And so having an annual wellness visit to check the screenings, it's based on age, family risk factors, are all so important, as well as part of having a family doctor.
I think that's great. I love that. Know your numbers. It's very important. Let's talk to you a little bit about women and why it's so important that women in particular have a family doctor, maybe what their needs, extra needs might be compared to men.
So, so especially for women, a lot of times they're kind of like our gateway patient, because we will meet women and they kind of screen the family doctor to see if this is the right choice for their family, their spouse, their parents, their children. But also, it's very important because I think as women, we're spread pretty thin. We are working. We have a lot of hats. Working, parents, children's wives, daughters, sisters, and so it's really important so that women can take care of themselves. One example I like to use is kind of like on an airplane, where if they say if you're going to use the oxygen mask, to put it on the adult first before the children, and that's what what I think about for women. To take care of women first, they have a lot of people to take care of.
That's a great comparison. Now, one thing too, whether you're a man or a woman, and when you can't see your doctor face to face, a lot of people now using patient portals. So just kind of want to get your take on that and how it can be a benefit, a tool, if you will, in your overall health maintenance program with a physician.
I'm actually a fan of the patient portal. I have had the good luck, I would say, in my career to have technology become a big part of my practice. And so having a patient portal has been fantastic. I think it's a great way for a patient to directly reach their physician. And pretty much spell out exactly from the patient's words what are happening, instead of it go through, somebody taking a message and then jotting down because they've got a bunch of things going on. And more importantly, I like reading the information myself and then deciding, do I need to have my nurse call the patient and ask for more information? Do I need to call the patient myself? Does this patient need to come see me, or should they go to the emergency room? It really helps triage, to give a sense of what's happening. And also in the big picture, really just respect somebody's time and money, Like sometimes you just don't know if you need to come in for this. And a lot of times people will say, oh gosh, if I had known that, I might have done something different. So it helps give, some guidance.
Absolutely. And briefly on this too, anyone who's concerned about safety, privacy with portals, just briefly, what can you say about that?
That is very important. That's something, at least in our health system, that is like a fundamental consideration. So we use a token, and our portal is through a secure electronic record, and so that helps keep the safety guarded.
Absolutely, a little peace of mind never hurts at all. Okay, Dr. Sharma, great start. We have a lot more, of course, coming up, so I know you're going to be here with me, and we hope everybody at home will do the same, because still ahead we're going to talk more about the science behind whether a healthy outlook on life can actually lead to a healthier life. And plus, you can always check out our website, allhealthallthetime.com, to submit your questions for the doctors, learn more about the Health Channel. So stay with us. We'll be right back.
Or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
Thanks, Coach. Thanks for teaching me about teamwork and leadership.
Thanks for showing me that sports help me stay healthy and do well in school.
And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion. And how to protect my head and brain. Because one day,
I want to be a teacher,
an astronaut, scientist,
Or a coach, just like you.
Thank you for protecting my future.
Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Migraines are pulsating headaches that often occur on one side of the head. If you suffer from migraines, you're familiar with the throbbing, one-sided pain that makes you sensitive to light and noise and causes nausea or vomiting. Some home remedies for migraine pain include changing your diet, monitoring triggers, scalp massages, using an ice pack, anti-inflammatory herbs like peppermint or chamomile, and staying hydrated. Contact your primary care physician about treatment options available to you today.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis here at the Baptist Health South Florida Studios in Coral Gables. And I'm here with Dr. Deepa Sharma, family medicine physician with Baptist Health Primary Care. Dr. Sharma, it's been great talking with you so far this hour, and now we're going to get into something a little fun. Imagine this. You're completely stressed out. You've got work deadlines bearing down on you. Your family needs some help with an elderly relative who is sick. It is easy to feel out of control and miserable. So Doctor, I don't think maybe there's really not much surprise, as this woman in the picture can show us, that, you know, this kind of stress can really set us up for being sick, right? And disease.
Yeah. I mean, I think all of us can relate to this image.
Yes, we
I'm
can.
sure there's probably a meme that could come from this. But yeah, it's overwhelming, and stress is overwhelming. But it's also part of life. I wish I could say that you know, we're not going to have stress in our life, but
Right.
I don't know that that's the case. So,
Right.
but you're right. I think it's more important that we learn how to cope with stress and manage the stress, because stress. What I want to explain a little bit about stress is that what happens in the body is there's a natural release of cortisol, which is a hormone. It's our stress hormone. You know, in the days of cave people running from lions, saving your life, cortisol would rise, and we don't have that now. But it does cause a change in all of our tissues in our body.
Okay.
And then so having stress is physical, and controlling stress will help some of that physical symptoms. And so what you were saying, it's very important to manage stress.
Okay, and it's important. So important also is trying to have an optimistic outlook. And here's a little incentive about why you might want to do that. So recent studies have found women who were more optimistic had less heart disease than women who were more pessimistic. And actually, that's just part of the story. You know, different studies are out there showing that a healthier outlook can lead to a more healthy person in general. And actually, we have a graphic that kind of shows us some of the great results here. So people who are optimistic are, and Dr. feel free to chime in here, more likely to follow medical advice, take better care of themselves, and maintain strong social support network. So what are you seeing, doctor, in your own practice with people that you deal with on a day-to-day basis about those results?
That is 100% true. I will say that my information confirms the results of the study. But you know, it's absolutely true. Compliance is so important with medical treatments and instructions, and again, particularly when you're not feeling great and you're ill. I mean, it really just sucks to be a patient, and you know, and you're vulnerable. And so having an outlook that will encourage you to comply with treatments, to encourage you to feel like you want to feel better, these are the things that this graphic, allude to, and I 100% agree.
Okay, now for anyone out there who might be saying, well, I'm not really that optimistic person, I'm not that person who was born with a sunny attitude. The good news is there is still hope for all of you, those types of people out there. We actually have some strategies that we can share with you about ways to be a little bit more optimistic. So that includes focus on the things you can control. Now, that's actually a big thing I need to work on. Also, you can identify thoughts and behavior that you can change. Surround yourself with positive people, and I'm just going to chime in and say that includes on social media. Don't follow negative people. Follow a healthy lifestyle, and smile and laugh often. So, I mean, doctor, what do you think about these strategies, these tips?
I think these are some really great tips. A couple of things that I would add to this. First of all, I think that this is always a work in progress.
Sure.
So I don't think that you reach a point where you're like, I'm optimistic and I'm home free now. I think that this is something we have to work on. I often tell my patients, I see it as the way you have dental hygiene. You have to wake up and brush your teeth every day, and you don't have to remind yourself to brush your teeth, but you have to do it. And that's the same thing with your emotional health and having a positive outlook. And so, yeah, I think all of us have a work in progress when it comes to that. But focusing on things you can control, I usually encourage patients to know that sadly, we can't control all the things that happen to us, but we can control how we feel about them and react to them. And so when you're trying to work on focusing your control, that's kind of the direction that I encourage. Identifying thoughts and behaviors to change, baby steps. Trying to revamp your entire personality is not going to happen overnight, but just finding little changes that you can make, surrounding yourself with positive people. And I agree with social media, that's an extra hurdle or obstacle that we have to deal with. And a lot of times people say, well, what makes somebody a positive person, you know? And that's also not easy to answer, but just having an idea of being solutions oriented. You know, problems are gonna come, but you know, it's okay, we need to vent, but having a solutions oriented type of personality is desirable. So, you know, especially when there's health involved.
Yes.
And then smile and laugh often, I think, whenever possible.
Yeah, and you know, sometimes it really is tough to do that, doctor. I
Yeah.
mean, there are days you just think, really, how do you even make this up? You can't, right?
can't.
But I guess they do say humor is the best medicine. You hear that a lot, I'm sure. Or
Yeah.
laughter is the best medicine. So
Yeah.
it's not always possible. We know
Yeah.
that, but it's, you can try.
You can try, yeah. And I think, I mean, the other thing is no one is isolated and feeling stressed. And so using your resources and understanding that people around you also want to see you happy and healthy, and being brave enough to use those resources, you know, that's important.
Yeah, and again, not to take anything out of being positive, but I think it's also important to accept there are going to be times, as you said, we do need to vent, and maybe things do get overwhelming. And it's okay to have a moment where the world isn't perfect, and to
Right.
admit that, I think, to yourself, and
Yes.
even tell the people around you, you know, listen, I'm not having the greatest day, I'm just warning you now. So
Yes.
it's also about being honest with yourself, correct?
Yes, yeah, I couldn't agree more. And I think so many times we just try to take on so much, and then we get so much on our plate, and then we may be perfectionists about everything on the plate. And so I think being forgiving to yourself, being honest to yourself, I think that's probably the first step in deciding that you want to feel better.
Yeah, definitely. And feeling better, you know, again, more to kind of motivate people to try to get to that point when they're ready. We kind of already talked about optimism and what the study shows, and then positive thinking in general has been linked to a lot of benefits as well. Depression, of course, being one of them, which is probably not a surprise, but how about this? They talk about a positive attitude. Positive thinking has also been linked to a healthier immune system. So, doctor, I guess maybe you could react to that as well.
Yeah, I think again, a lot of that has to do with the stress hormone and cortisol and how it affects all of our tissues. And whether we're not physically running from a lion, but you know, the lion is all our work deadlines and life stressors, our tissues do get affected. If you know, stress affects our sleep, and sleep affects our immune system, and so you know, it does. No tissue is immune from stresses.
Okay, and following up on that, the cardiovascular health, they also say, is improved with people with this positive thinking. So is that also related to what you're saying, there's not too much cortisol, or what's happening in the body that may also improve our cardiovascular health?
So, and that's an excellent point, because while we cannot control our stress response, if you're stressed, you're stressed. But what we can control is eating well and exercising. And so what the studies found was that people who have a more positive outlook were more likely to eat well and exercise as a coping strategy for stress, which made the stress less destructive cardiovascularly. And so instead of just kind of now not taking care of yourself, eating well and not sleeping and not exercising, which is no surprise is going to cause blood pressure changes, your pulse to go up. People who have a better outlook tend to exercise, eat well, and so their risks are reduced.
Okay, that makes good sense. Now again, we've been kind of focusing on the individual, having the positive outlook and positive thinking in all elements, but let's kind of talk about, you know, loved ones or friends. And if, I don't know, you notice one of your friends is down, or someone in the family, you know, any advice you can offer about maybe making our positive attitude contagious for the other person, or do we just kind of have to know when to back off? Like, what would you say is kind of the careful balance that we have to strike there when we think it's time to boost somebody else's attitude a little bit?
I think careful balance is probably the best way to mention, you know, the approach. Certainly anybody who's going through a hard time, it is a hard time, so I think being as empathic as possible. I think patience is the key there. And so as a friend or a loved one, just being patient until the person's ready to take help, but just showing your support, letting them know that you're there and that you're there for when they're ready, I think that can go a really long way.
All right, good to know. And any other tips, whether it's the, you know, we as individuals or our loved ones looking on us, just any other tips you can offer to try to increase our positive thinking and make us focus more on what's good, then what's bad, you know, the half glass versus half empty. Again, doctor, any other tips you might have?
Yeah, I sometimes like to discuss with patients to focus more on the haves and not the have-nots.
Great.
And so to think about what options are there instead of what limitations are there, and just keeping that in perspective, because having that choice feels better.
Yeah, that's a good point. And you know, going back to social media and surrounding ourselves with positive people, I think sometimes, you know, you're looking at, a lot of people paint a rosy picture all the time, right? And maybe this kind of falls into what you just said about the haves and the have-nots. You think, oh, I wish I was doing that, or I was at that location. What would you also say too about just kind of watching out how social media maybe affects your attitude and what you're thinking? Just a little word of caution, maybe.
Yeah, a word of caution. This is something that I do discuss with my patients because it is around us all the time, and it's very easy to be distracted. But I do think that social media, you know, we obviously have a value for staying connected, but I always like to remind patients that it's a highlight reel. You know, people are putting the highlights of their life,
great.
and to keep that in perspective when they're looking at that information.
All right, I like that a lot. It's a highlight reel. It's not necessarily all true. Okay, Dr. Sharma, this has been a great discussion so far. We're going to have a lot more. And coming up next, if you are stressed out, we're going to talk about ways to help you relax and improve your mood. Plus, we offer some advice specifically for all you moms out there. And don't forget, you can always head to our website, allhealthallthetime.com. That's where you can submit questions for all the doctors here. You can learn more about what's on the Health Channel. So be sure to stay with us. We'll be back after this break.
Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. You may no longer want to engage in normally enjoyable activities. Depression also creates a longer sense of frequent melancholy. If you feel you are in slow motion or you can't stay focused on an activity, these may also be signs of depression. Depression also causes people to feel tired all the time or the need to sleep too much. Contact your primary care physician if you are experiencing any of these symptoms to determine next steps.
In-toeing is basically when your child comes in and walks with their feet pointing towards the midline. Most people walk with feet out about 10 degrees, pigeon toes with the foot inside. In-toeing is very common. It's by far one of the most common reasons for us to see patients in the office. But most pediatricians do a very good job at telling you if there's something more that needs to be done. It can come from 3 different places. It can come from your thigh bone, your tibia, or your foot. And any one of those things can be curved to cause the foot to progress forward. We now know that this condition improves on its own. It doesn't cause any lasting issues, no arthritis, no other joint issues or bony issues. And the bracing can actually cause weakness that can maybe delay the progress of them getting better on their own. More than 90% of these kids will outgrow this, absolutely.
If you're at risk for type 2 diabetes, it is very important to increase your physical activity. Most people need to start slow. Get motivated by doing something you enjoy. Here are 5 simple steps to get moving. Number 5, exercise while you watch TV. You can do arm or leg lifts. Simple weights or canned goods can be used. Number 4, take the stairs. Start slow. It raises your heartbeat and builds muscle strength. It also works your lungs and waistline. Number 3, go outside. The world is your gym. Explore. Do things you enjoy. Discover a new park, play catch, bike. Spending time outside raises your levels of vitamin D and puts you in a better mood. Number 2, dance around your home. It is a great form of exercise and fun. You can burn 300 calories in just 30 minutes. Number 1, walk. Do it alone or with a friend, anywhere, anytime. It is the ideal low-impact exercise. 30 minutes a day makes a big difference.
Strength training is important for all of us, but when we're talking particularly about women, it becomes crucial, especially after menopause. If you think about how we use our muscles, we use our muscles for everything. We use them during our daily lives, to go to the grocery store, to carry our kids, to play with them, to do stuff around the house. The more we prepare our muscles for these activities and the more conditioned our muscles are, the better off we will be, and sometimes even prevent injuries from those daily activities. Also, after menopause, when we lose the protective effect of estrogen as the levels go down after menopause, then it becomes more important because strength training and resistance training can help maintain a healthier bone mineral density and sometimes even be a part of the treatment for osteopenia and osteoporosis. So I think resistance training for women is really important, it's critical.
You are watching the Health Channel, all health, all the time. I'm Laura DeAngelis, and I am joined by Dr. Deepa Sharma, family medicine physician with Baptist Health Primary Care. And Dr. Sharma, again, as a family physician, obviously you treat a lot of moms. So I'm sure that you would definitely agree that these moms are probably some of the busiest people on the planet. So what advice would you say to moms who are watching right now back at home just about, keeping it all together when things get crazy and the importance of doing that?
Yeah, moms are super busy. You're absolutely right. And, I think as a mom, life is different. And, I've read little sayings where it says, when you're a mom, your heart doesn't live in you anymore. Your heart lives in your children. And so life is different, and there's a new normal from before when you were not a mom. And so I think finding a balance is really important, and it's that airplane analogy that I used before where, you want to give yourself oxygen first before you put the oxygen on your child. And so I think my advice to moms is to make sure that you are taking care of yourself, that you carve out the time to take care of yourself, even if it's inconvenient. It is important for the long run.
Yeah, and like you were saying with the airplane analogy and all that, if moms are not taking care of themselves, they really can't necessarily take care of the rest of the family. And another interesting element now, doctor, which I'm sure you're seeing is, they're calling this generation of moms the sandwich generation, or women, I should say, the sandwich generation, because they're taking care of their children and then they're taking care of their parents, their aging parents. So you put those two combinations together and now you're really adding the stress to a new level. So what would you say kind of about that element, that there's almost two sets of people sometimes that a mom or woman today might be taking care of?
I actually have a lot of patients who I will say, you're part of a sandwich generation, and you are, you don't have the time to take care of yourself. I recognize that, but you have to make the time, which is where, it gets a little dicey, it's a little hard. Yeah. I think as the physician, recognizing that my patient is in a sandwich position is so important, because trying to make my patients' health become convenient is important, helping them know that they can use the portal to reach me, sending out prescriptions for lab tests when I know that it might be hard to get into the office. A lot of physicians, including the ones in our group, we have office hours till 7 at night and weekends, because we recognize that it's really hard for patients to get in before 4 o'clock on the weekdays. And so I think as a physician, it's important that I recognize that, and then it's really my job to try and support them. So I usually tell my patients, I say to them, well, you're taking care of a lot of people, and so now it's my job to take care of you.
I think that's wonderful. Your patients are lucky that they have you then to do that for them. Now, one way, I guess, for moms to maybe take a little care of themselves, take some time for themselves, would be exercise, right? I mean, health and well-being, everything you hear from cardiovascular health to obviously stress relief now, is get some exercise. So it can be a dropped piece of the puzzle when you're too busy, which we just want to get from you again, why it is so important maybe for mom, busy woman in general, to really find that time for herself to get a little activity.
Yeah, the exercise is so important. In fact, there are a lot of studies that suggest now that less than 30% of Americans get the exercise they need, which means that most of us are just not exercising. And I think you're absolutely right. That's the first thing to fall off the plate. But I think we kind of need to rehabilitate our thoughts on exercise. Our generation is moving into a time where we're more sedentary than ever. There's studies that say that sitting is the new smoking. And so we're more sedentary. You don't even have to get up to change the air conditioning, the channels on the TV. And then we don't have time to exercise. And so The fact that we all even wear Fitbits to see if we're doing enough steps is an indication of that. So I think rehabbing our concept of exercise is really important, and making time for it the same way that I discussed, like with dental hygiene. Like, you don't have to think about brushing your teeth. You should not have to think about exercising. And then the benefits of it, you know, the natural endorphins that are released, they are a feel-good hormone. It's also your time to take care of yourself, and you do charge up. You charge up, you can manage stress better. You feel like you haven't neglected yourself. Generally, you tend to eat better. You make better food choices if you're exercising. So a lot of times when I'm seeing patients and we evaluate their organic causes or the reasons that they're worried about not feeling great, we talk about sleep and diet and exercise, and then we discuss that, you know, exercise is organic, it's natural, it's, you know, can be cost effective. So if that was a treatment that you need to feel better, it's a good choice.
Okay, great. Well, we're going to get back to exercise in just a minute, but we actually found out we have a phone call right now from a viewer. Her name is Jackie, and she actually has a question about taking Premarin. So, hey, Jackie, you're going to be on with Dr. Sharma right now.
Okay. Hello, doctor.
Hi, Jackie. Thank you for calling.
Let me ask you, my cousin who just turned 70 was prescribed Premarin, which is an estrogen that helps with her vaginal dryness and vaginal atrophy, especially in women after menopause. But she's concerned about the potential increased uterine and breast cancer risk associated with Premarin that is even outlined on their own website. So in your opinion, do the benefits outweigh the risk? And is there a safer alternative medication that she could use?
That's a really great question, and actually I get that often in the office. I think that as women, we have gotten a lot of mixed messages about hormone replacement and the symptoms of menopause. I don't have an easy answer for you on your question, but this is what I usually recommend. I recommend seeing a gynecologist to discuss the treatment options. As you asked, there are other options. There are topical treatments that can be used that may have less risks and side effects. And then discussing the benefits and risks. And in general, whenever we're considering different therapeutic options, it's important to think about, do the benefits outweigh the risks? Nothing is really risk-free. Even not taking care of something has a risk. But that's generally my take on it. So I think it's kind of individualized, and having that conversation with your gynecologist so you're clear really helps make that decision.
Okay. Thank you so much.
Thank you.
Okay, great. And Dr. Shi, in addition to her question, you just brought up a great point. It's very important for everyone to, of course, speak with their own physician about a question, but also good to know that you may hear about a treatment, but there are other options sometimes that might just work better for you that you didn't even know existed until you actually speak with your physician.
Yeah, and I think that goes back to what we were talking about, having a family physician. And I oftentimes have patients who will see a specialist and then they'll say, hey, this was the treatment plan that was outlined for me, and what do you think? And I might not be a gynecologist, but I can help guide in knowing what kind of questions to ask and understanding how to navigate the health field and specialists and medications and kind of get a better sense of what you're doing.
Absolutely. So getting back to, again, individualizing things, even on the exercise front, which we were talking about before Jackie called in, what do you tell your patients? Again, we're talking about the benefits of exercise, whether for a positive attitude or just getting rid of stress, or for the physical components of it. But what do you recommend to your patients who maybe are starting from an inactive state about, realistic goals to set for themselves when it comes to exercise?
So that's a great question, and I think many times we have patients who are coming from a sedentary lifestyle and they're excited about exercise. We see it a lot around the time of the new year because they're New Year resolutions, and then sometime in February we have a lot of overuse injuries that come in, sprains and strains.
Right. And everybody's gone from the gym.
No one's going to the gym. Slowly but surely, baby steps, and recognizing that you have not been active, and so slowly moving forward. I usually tell my patients that if you're not moving around much, anything you do is better than nothing, and to be forgiving of yourself. So when you get up, it's unreasonable to think you're going to suddenly be able to exercise for 60 minutes and not feel sore the next day. But telling yourself that even if you did exercise, say, I could only do 10 minutes today, but that was 10 minutes more than I could do yesterday. And so just baby steps, and know that it's a long-term goal, that these kind of changes do take time, but sticking to it and doing what you can.
Okay, absolutely, that makes sense. And you know, there are different forms of exercise, and you just mentioned not everybody's ready for that 60-minute vigorous activity. So can you kind of help us also figure out, you know, there's low, there's moderate, there's vigorous. So how do we maybe determine how hard we're working out when we're actually out there doing something?
So basically, if you've not really been exercising, starting with low intensity is the safest.
Right.
And you know, we do err on the side of safety first. But so, you know, walking, low impact walking, swimming, and then just slowly conditioning yourself. And I think it's really based on age and general health and conditioning to help determine what would be the safest level of exercise. But I think having that conversation with your doctor is important, so that you don't engage in an exercise program that may actually be destructive for your body, and your physician can determine if you need additional testing or need to see a specialist to clear you for a higher intensity.
Right, but again, there are just so many benefits to the exercise, whether it's, you know, allowing you to take charge of your life, feel good about your choices. You talked about earlier, you might want to eat better because you are exercising. So I think it's so worth repeating that baby steps are everything. You know, Rome wasn't built in a day. You're not going to go from sitting in your chair to running a marathon next week necessarily, right?
Yeah, and doing it every day. That's what I encourage. It's not, you know, hey, I did 30 minutes 3 times a week, but now I feel terrible. It's like, no, just do what you can every day, and remind yourself that if you don't have to go that extra minute, but you will be there tomorrow, then be there tomorrow. That's what's really important.
All right, fantastic, doctor. Thank you so much. So we are going to be coming right back. We have a quick break, and we're actually going to have a Mother's Day checklist for all those special moms in your life, so you're not going to want to miss that. In the meantime, you can always check out our website, allhealthallthetime.com. Stay with us. We'll be right back.
Enjoying mental health means having a sense of well-being, being able to function during everyday life, and feeling confident to rise to a challenge when the opportunity arises. Just like your physical health, there are actions you can take to increase your mental health. Boost your well-being and stay mentally healthy by following a few simple steps. Connect with others, take time to enjoy, participate and share interest, take care of yourself, challenge yourself, deal with stress, rest and refresh, and ask for help. Contact your primary care physician if you have any questions about your mental health.
What we're really talking about when we're encouraging people with arthritis to be more physically active is doing moderate physical activity like walking, swimming, biking that get their heart rate up a little bit or get them breathing a little bit harder.
Aim to do moderate physical activity 5 days a week for 30 minutes a day. Exercising as little as 10 minutes at a time will allow you to achieve the recommended 2.5 hours per week and get real health benefits.
You want to listen to your body so that if you're too sore, a couple hours later you know to cut back, maybe do a little bit less duration or frequency.
It's not running a marathon. It's not the no pain, no gain idea. It really helps reduce some arthritis-specific symptoms like pain, swelling, limitations. Things like fatigue and depression also improve with physical activity.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
When it comes to sexual violence, it's important to know the facts. But there are just a few other things you should know. Sexual violence includes rape and any other unwanted sexual contact or experience. About 1 in 3 women and 1 in 6 men have experienced sexual violence in the form of physical contact at some point in their lives. Violence starts early. Before the age of 18, 8.5 million women first experienced rape. Victims of sexual violence can experience depression, anxiety, and suicidal thoughts. Sexual violence impacts everyone. Its effects ripple through families, neighborhoods, and workplaces. But we all play a role in its prevention. Public health, businesses, schools, communities, and you can work together to stop sexual violence from happening in the first place.
Welcome back to the Health Channel, all health all the time. I'm Laura DeAngelis, and I'm coming to you from the Baptist Health South Florida studios in Coral Gables. In this hour, I have been speaking with Dr. Deepa Sharma, family medicine physician with Baptist Health Primary Care. Dr. Sharma, we have had a very uplifting, positive conversation to this level so far at this point in the hour. And, you know, basically, we've been talking about being upbeat, and we want women to be upbeat, men to be upbeat, but right now we're going to talk about, you know, moms, the Mother's Day. We all know a lot of people who are going to be celebrating this week, but we also want to know about some alarm bells that might be going off in these special women that we need to kind of look for and be sure that we're preventing a bigger problem from developing later on. And we actually have a checklist to make sure that we are taking care of ourselves as women, and also that these women are taking care of themselves too. So that checklist is going to include some of the following items. So that does include making sure to see a gynecologist for a visit, also having a primary care visit, doctor, seeing a dermatologist to catch skin cancer in its earliest stages when it's most treatable. That's actually something I do every year because I have a lot of moles, so I get that one. You also want to get an eye exam, and of course, last but certainly not least, we want to see that dentist twice a year, get those teeth cleaned. So, doctor, help us out here. Give us, again, your take on this Mother's Day checklist. I know you're the one who put this together for us, so let's hear your advice.
Yes, so a Mother's Day checklist, and happy Mother's Day to everyone out there, including my own mom, who I brought with me today so that she could have an experience. But yes, taking care of your moms, and so I thought it might be nice for us to give a checklist to our moms to make sure that they're taking care of themselves. And as you said, prevention is better than cure. So the gynecologist, to make sure that you're up to date on your breast and pelvic exams, a primary care physician to assess the numbers, like I mentioned earlier, knowing your numbers, your blood pressure, your blood sugar, your cholesterol, and just talking to the doctor about things you should be doing for screening. As you mentioned about skin, especially here in South Florida, I think dermatologists will all agree that the screening could be improved. And so having your skin checked, and then dental and eye exams, of course.
Yeah, very important. You know, again, I was just saying the dermatologist is so important. I have like a lot of moles, so I feel like every year there's something a little different that needs to be looked at. So again, just something important not to overlook.
Agreed.
In each individual patient. All right, and you know, let's again, we are talking about Mother's Day here, and I guess I'll say Happy Mother's Day to my mom too. And you know, there are so many special women, whether you're a mom, a wife, a sister, or your aunties, like the two of us are here. A lot of special women out there. So, what message would you want to give to all these incredible ladies out there to be upbeat and just about a positive outlook in general?
I think the message that I encourage the most is that we have to empower each other, that as women we should help each other, know that we're there for each other. We are not in competition, but we're a team. And so I think it's women helping women, and I think that's my big take-home message.
I like that. That's very strong, and like you said, we're definitely a team. Definitely feel that. And you know, doctor, in general, let's kind of just bring home all of the uplifting things we've discussed this hour. You know, again, all of this is about having a positive attitude or trying to look at the sunny side of things. So again, talk about what you see in your practice and what you try to share with your patients on that note.
Yeah, absolutely. With my patients, I encourage them to realize that they may not have control over what happens to them, but they do have control over their reaction and what they want to do about it. And so I encourage moving forward, thinking about solutions, thinking about options, treatments, the haves versus the have-nots. And also having an important perspective and recognizing what resources we need. And as a physician, that I feel it's my job to say like, hey, I think things are going to be a little tough. So I'd like for you to consider talking to a therapist, or I'd like for you to maybe discuss this with family or friends, because you're going to need some support. It's really important because it is part of your health. Health is not just your cells, your lab test results, your organs. Your general health is really important.
Absolutely. And it looks like there's research now, we talked about this, that actually proves that you really do want to try to keep that positive outlook going, right? So again, what are some of those benefits that we were talking about?
Yeah, the benefits, they're tremendous. It improves compliance with medical treatments, with follow-up care, which is so important, getting the tests done that we order when you come in complaining of a symptom, reaching out to your support networks and making sure that you have your resources, being active in your own self-care, eating well, exercising, and focusing on what you can do instead of what you can't.
Absolutely. And if we are looking for maybe extra endorphins, if we need them, exercise is a great way to do that, right?
Yes.
So again, let's talk about the importance of getting in some activity to just make us feel better overall.
Yeah, and just to get moving. Our bodies were not designed to be trees. We're not meant to be sedentary. And so movement is essential in our bodies. Our cells respond to that. Our hormones respond to that, and it's just so important for all of us to get moving.
Absolutely. And again, tips to help people who might not really be sure where to get started when it comes to being a little active. Maybe they have been sedentary. You said before, I love that. I love the term, I've heard it, that sitting is the new smoking.
Yeah.
So if we're trying to get out of that mode in our own lives, what would you just, again, recommend to your patients?
I usually talk to my patients about is we build this inertia in our mind that we have to kind of overcome. And so to not look at movement as an obstacle or a chore, but to look at it as something natural that our body needs and desires. And if you look at it as something that your body wants and not that's an obstacle or a chore, I think it will change your perspective of wanting to move around more. And so I encourage patients to see it that way. This is not a punishment. Your body wants this. It's going to respond well to this. So that's how I usually encourage.
Absolutely. And another thing which is fun, we kind of talked about women being a great team. One thing with exercise is it can be a social experience too, right? I mean, it doesn't have to just be you by yourself on the sidewalk or on a treadmill. Let's talk about the social component. There's something fun about, especially now with the seasons changing in a lot of places, if you want to maybe go outside and join a friend for a walk or a workout, right? Let's be social. It's not just, like you said, about the workout itself.
Yeah, and also group classes, exercise classes. Like you said, you don't have to be on a treadmill. You could be in a Zumba class or a dance class, something that's exciting to you, fun, different. And yes, it can be social. Sure, for a lot of people, it may be their only time that they have to themselves. And then for a lot of people, it could be the only time that they can make calls, if they are on a treadmill or walking outside. But yeah, absolutely. Just making it fun for yourself and wanting to do it is going to increase the likelihood that you'll actually do it.
Yeah, and it's funny, teaming up sometimes with a buddy also makes you a little bit more accountable. If you say to your friend, hey, let's take this CrossFit class together or whatever it might be, and we'll grab some tea afterwards, or maybe we'll grab a bite. Now if you don't show up, it's not just you that's lost your workout. You almost, I don't want to let my friend down, or I want to show up. So there's a little, I think, incentive too that's added, right?
Yeah, I couldn't agree more. I think accountability is a really important part of wanting to be successful in being more active and healthy. So yeah, you're absolutely right.
Okay, and in addition to the exercise, again, just other tips for putting your best foot forward every day or just feeling good. A diet is obviously a huge component in that, right, doctor?
Yeah, diet is a huge component. And also what we were discussing earlier, recognizing that some days might not be our best days, and kind of preparing yourself for that and realizing that, I might need to take things a little slow. One thing I actually tell my patients is when we're feeling overwhelmed, we sometimes feel like we need to do things quickly and get through them because we have so much to do. And in fact, I usually say when you feel the need to speed up is when you should probably slow down. And that's when you start seeing less mistakes happen and your body isn't in such a stress state stressful state. So, you know, on those mornings when you realize that, hey, I'm feeling a little overwhelmed today, taking the time to like take your breath, you know, and if you need to drink your coffee slowly, drink it slowly, you know, and just take it slow.
All right. And, you know, again, since we are coming up on Mother's Day, what would you like to say to the husbands, the brothers, the fathers, you know, the people who have these special women in their life about kind of recognizing, you know, Mother's Day shouldn't just be the one day of rest, so to speak. You know, you always hear these stories like my friends tell me, oh, the kids made me breakfast and then they did everything around the house. I didn't have to worry. That's just one day.
Yeah.
So I guess, you know, what would you also say to, as a family physician, you said, you know, you see a lot of family dynamics. Maybe a reminder to everyone else out there that, you know, it's not a bad idea to stop and maybe appreciate mom now and then and give them a break.
Yeah, absolutely. And to recognize that we're all part of a team, and that if there's something that we can do to help each other, being empathic, being patient for each other, and supporting each other, I think that on a daily basis is probably the best gift you could give your mom or any of the special women in your life.
Yeah, I think that makes good sense. And speaking of gifts as well, you know, the gift of health, obviously important. So any kind of final message, if you will, about, again, women taking control of their health, why it is so important to be your own advocate. If you know, sometimes people think, well, I'm not feeling my best, but I'm probably just tired, so they might ignore it. So when is it time for a woman, or anyone actually, but to really listen to the body and know, hey, I need to go speak with Dr. Sharma. I need to go find out what might be going on here.
That's a great question. I think that not dismissing your symptoms is really important. And if you haven't already, whether you're not feeling great or you're feeling great, to start looking into the process of finding a physician for yourself. And then also making sure you're optimizing your diet, your sleep, your exercise regimen, and in response to any of those, if you feel like you're taking care of yourself and it's just still something doesn't seem right, just getting that checked out. I usually discourage dismissing symptoms. So
okay, that makes good sense. Well, Dr. Sharma, these have been wonderful messages for all the moms out there, women, people in general. We were really thrilled to have you with us, and we hope you'll come back and see us again real soon.
Thank you. I loved being here. Thank you, guys.
Okay, great. Well, and thank you all so much for being with us today. That is all the time we have, so be sure to visit our website, allhealthallthetime.com. That's where you can ask doctors like Dr. Sharma your questions and find out about all different health topics from A to Z and learn all about the Health Channel here on South Florida PBS. I'm Laura DeAngelis. Thanks so much for watching. Bye-bye.